a good segue now to talk about our next topic is something called shockwave therapy. And Dr. Saviette, he's kind of researched just a little bit, and he's kind of at the forefront of shockwave therapy. So I'd like you to start talking a little bit about shockwave therapy, Dr. Saviette.
Yeah, absolutely. So I've been a big fan of shockwave therapy for several years. Have done multiple presentations and research projects on it myself, and been pretty much up to my eyeballs in it for a few years now. So was excited to join a practice where shockwave was a component of the practice. So what shockwave therapy is, it's not somebody just in there whacking away on you with a mallet or anything like that. It's a way to manipulate some of your soft tissues, be it a tendon or wound or a bone or a ligament injury, to try to stimulate a physiologic response that's innate and kind of already within your body, to get it to respond to an injury that might be there.
So let's, we're going to show a picture right now of an actual shockwave machine that we use. And could you explain a little bit how it works? What are the mechanics of it?
Yeah, so there are several different types of machines, but the machine we use in our office, it has a handheld device, essentially, that's connected to a machine. And then the machine provides a pneumatic flow of high pressure and low pressure. And what that does is it moves a projectile within the handpiece.
It's a little piece of metal.
It's a little, basically a little BB that oscillates back and forth within the handpiece, and you keep that handpiece in contact with the skin, and the projectile will hit the tip of the device, and then that creates basically a concussive wave that goes through your tissues. And that's the very easy explanation of it.
Yeah, and so those waves, you put a gel, ultrasound gel on there to conduct it?
There's a little conductance gel which just helps that energy really effectively get in there. You lose a lot less of the energy when you use a conductance gel. If you don't use a conductance gel, then you lose some of that energy to sound waves and the like.
Mm-hmm. And how was this first used, this technology? We're using it on the foot and ankle and tendons and things, but where was it first used?
So it really developed in the early 60s, I believe. They were using what are called focused shockwave machines, and what they would do is they would submerge a person into a tub of water, and that was their conductance gel, essentially. And they used an ultrasound, or rather a fluoroscopic X-ray device to target kidney stones, and then they would shoot a high level of energy at a focused distance, and it would come together and hit this kidney stone, causing it to oscillate and fragment. So rather than passing a lima bean-sized kidney stone, which I imagine is probably pretty painful.
It's really painful.
You end up passing sand. So it fragments that calcium-based kidney stone and cause it to break apart, and then you can pass it without much pain. So that's where it developed.
Yeah.
But what they were starting to see is some of these people who were in these tanks were relating, oh, hey, my lower back pain is starting to go away. And then some other folks got kind of wise to that and started using it for different things. The earliest research after that was in calcific shoulders. There's been some stuff on lateral epicondylitis, so tennis elbow. And then from there, some different entrepreneurial doctors started using it for different things. They said, hey, I'm reading about this, let me try it for plantar fasciitis, let me try it for Achilles tendonitis.
And that's how you primarily use it?
Yeah, so initially I kind of got wise to it for plantar fasciitis. Plantar fasciitis is one of those things, 90% of people get better with the standard of care treatment, whether it's physical therapy, steroid injections, night splints, some home stretching, foam rolling. 90% of people get better with that. There's the 10% then that end up in this chronic phase where it's not improving after about 6 months. And then you tend to see research on that 10% of people who don't get better with things.
Okay.
And it's been utilized a lot in that population. So people who were not improving, and then they got shockwave therapy and they start to improve.
And so what do those, if we're talking about the kidney stones that get targeted and they get broken up, what are you doing with the fascia? Is it breaking it up? Is it causing an acute injury?
So it's not so much causing an acute injury. I have heard that before. It's kind of an easy way for a doctor to explain what's about to happen physiologically to you. And I've I've been guilty of it myself at times to say, hey, here's the long and the short of it. I give the Cliff Notes version. But in reality, what this is it's not so much causing an acute injury as causing your tissues to respond as if there is an acute injury. So when those physical energy waves from the impact of the projectile get to your tissues, your cells respond to it. Our cells are always responding to the environment that we live in. So if you start to run a lot, over time your bones become more dense to accommodate that level of forces that are going through your body. So this is very similar, except it's a high level of energy focused into certain tissues. So that mechanical energy then gets translated into chemical signals that our body responds to and causes a healing response in a lot of different tissues.
So let's try to simplify this down. So you hit a piece of tissue, whether it be an Achilles tendon or a plantar fascia, you hit it really hard. For how many times do you hit it? Is it usually 20 minutes, 5 minutes?
Depends on how many areas we're treating. The standard for most injuries is around 2,000 shocks, and we do it at a frequency of around 10 hertz. So you can pretty much hammer through that in about 5 to 10 minutes if you're working hard.
So you do that, and then there's a response from your body. What happens? What does your body do after that?
The whole cascade is very elaborate. Oh, yeah,
we're going to put a picture. Let's put a picture
up
of the cascade. So you can explain that another day. You can email him if you want to learn it.
It's mind-numbing. It's kind of the thing. Who needs Ambien when you have chemical cascades,
yes.
Right? What it does, the main thing that it does is it creates a vascular ingrowth process through this chemical signal called VEGF. I don't want to bore you with what it stands for, but it creates this cascade of events. So what Dr. Feldman was mentioning before about creating where there's an area that there's dysvascularity, not good blood flow, we're trying to institute some better blood flow. So really you're getting little arterioles and capillaries that grow in and begin to heal that tissue with better blood flow to that area.
So kind of comparing the two with PRP and then with Shockwave, is it one treatment for both of these, or is it multiple? And how long do you have to wait to see the results for either of these?
So PRP is usually a single dose treatment or several months apart with doses, if I'm not mistaken.
Yeah, it depends on the tissue, it depends on the extent. I might do 2 injections over the course of 3 to 4 weeks separation, or 6 weeks. I might just do the one as well.
And for shockwave therapy, it really is dependent on what the particular injury is. So if you have an Achilles tendonitis, usually the standard for that is once a week for 3 weeks. There's different literature that says once a week or once every 2 weeks for 6 weeks. But what the literature is pretty clear on is that it can take 6 to 12 weeks for you to really see a result with
So you have to be patient.
with shockwave therapy. So you need to be a little bit patient with it, but the results really are there for injuries that are both chronic and acute. You get a lot of high-level athletes that have an injury that's not responding, and they want something done to just get the stupid thing to heal so they can get back to what they want to do. So there's a lot of that.
Yeah, this typically isn't a quick fix. This is regenerative medicine. Your body has to heal itself. This isn't a movie that shows healing in a lab, and it takes time for your body to heal itself. So
it's probably going to be for those patients then are going to want to avoid surgery. So this is kind of like the last step before surgery for a lot of these.
It can be. That being said, if you're a high-level athlete or you're a semi-professional, or you would go nuts if you couldn't run every day like some of us, you kind of need your medicine out in the woods to go for a run. So some of those people, it's worthwhile to, if it starts to hurt, come in and get it treated early. It's kind of the penny of prevention.
In this one, there's no drawing of blood. There's nothing. It's a machine. Takes 2 or 3 minutes.
It's relatively low level of pain. So we start at a low level of energy to try to introduce you to the hand piece.
Kind of like when you're tapping it to go numb, and then you can increase it.
Our body's desensitized, just like my butt doesn't feel sitting in this chair anymore because I've been sitting in it for a while. Your body kind of responds and doesn't feel so much pain in that situation anymore. So The important thing is we have to get you to a certain energy level with the handpiece, or else it's not getting enough of a chemical response from your cells.
Okay.
That being said, we were talking about how it's not an acute thing. There is a level of pain relief that comes with shockwave therapy. Cellularly, you release a substance called substance P, and that dampens pain responses. Mm-hmm. And I know everyone's like, oh, must be the placebo effect of somebody hitting you with this little projectile, but it's actually been seen in veterinary studies as well on horses. A horse can't tell you that they feel better. All they can do is chomp on carrots. So they don't walk away lame afterwards. They're walking more normal after shockwave therapy. Yeah.
And similar to this other treatment we were talking about, or comparing it, is it only used on the plantar fascia and Achilles tendon, or can it be used on other areas? I think we've talked before about bones and wounds.
You and I have talked about this, but there's really good literature on several things. Plantar fasciitis is a good one and has been studied very hard. Achilles tendonitis, both right where the Achilles attaches to the bone, and above that where it's particularly not well vascularized.
So we'll show these pictures here so they can see these
those
two
areas. Also, it's been used for non-healing wounds or surgery sites. So that's skin wounds and diabetic ulcers. Sometimes those things need a little jump start with some increased blood flow. And I've done that several times in the office already. And then there's the non-healing fractures that sometimes need.
That's kind of a unique use for it.
It is a very unique use, and I've seen it used for acute fractures and kind of the garbage term of shin splints. I've seen it used for that as well.
Mm-hmm. Well, interesting. Sounds like
foot pain too.
Yeah,
works very well on the ball of the foot.
On the ball of the foot. Mm-hmm. And so the big question that a lot of people that are probably watching this are thinking, well, if all the athletes are doing these great ones, the PRP and the Shockwave, is it something that insurance covers at this point, or is it not covered? Who covers it?
So
that's where it comes down to for our patients.
It does. It's one of those things. Insurance companies are not in the business of getting you healthy as fast as possible. They're in the business of trying to keep you healthy. So it's unfortunately as well studied as Shockwave is. It's one of those things that most insurance companies will not cover in the United States.
But in Europe,
in Europe, it's well covered. So
you can go to Europe and do treatment.
If you want to fly to Europe and do a vacation and get your Achilles tendonitis treated, you could do that. I still think we're probably
less expensive.
Unless if you fly over, you're on their universal health care, I guess. So that being said, it's one of those things that if you've tried several other modalities and it hasn't gotten better, it's not toxic to tissue the way that steroid injections are. You can only do so many steroid injections into a plantar fascia before you're looking at a rupture just around the corner. So you don't have to stay out of activities if you have shockwave therapy, which I think is one of the strongest reasons to go for it. If we do a steroid injection into your plantar fascia, we're going to tell you not to run for at least a week. We're probably going to put you in a boot too. If you get shockwave therapy, have at it.
There's no downside. Anything you want to add to the shockwave therapy, Dr. Feldman?
It's great with the buildups people have during the latter. So the big training for marathons and triathlons, whether you're training for an Ironman or a half Ironman, or just those you spend a year of your life dedicated to a single day event, and you're putting your body through a lot to get to the race day. So if your body's not responding very well and you start showing signs of injury and fatigue or failure of some of the tissues to kind of hold up to what you're asking it to do, this is where the regenerative medicine makes so much sense, because you're helping your body get through it. So Shockwave is done often in the buildup right before a marathon, maybe in the last 3 to 4 weeks, called the taper phase of that, or a triathlon, or to get somebody through the big build phase that is 2 months before the event.
And there's really no downside to it?
Really just the insurance not covering it, so the patient has to be willing to do it, and to also pay attention to all the little things that go with it. It's not like have a shockwave treatment and you're healed.
And you're going to be healed.
Yeah, you still have to work hard at keeping your body as healthy as possible.
Yeah, it's very, very exciting.
Yeah,
These-
Shockwave's not a license to go nuts and keep hammering 100-mile weeks. It's kind of a warning sign, get you healed, maintain, and then usually you're back at it.
And get you
a couple
through it.
weeks ahead.
And the whole goal of this would be to get you back quicker than you would normally
Absolutely, yeah.
get back to the activity
Right.
you're at your same level.